As we begin, you will notice that all of the tabs that you will regularly need are available at the top of the page. The calendar feature allows you to easily schedule patients for different types of services. The patient profile tab is equivalent to a paper chart. This is where all of the patient's information will be held. The quick order is the one-page point of sale portion of the software. This is the fastest way that your optician and salespeople will be able to sell. The spectacle lens order option is a longer, tabbed-out version of the quick order. The insurance tab will allow you to quickly search for any insurance information, including outstanding claims. The item details button is to search inventory quickly for a certain product. The exam button will take the doctor directly to the appointments that are waiting for them. The emailing feature within My Vision Express allows you to email anyone from directly inside the system. The time clock is available for your employees to clock in and clock out easily. The inter-office messaging tab will help alleviate the post-it notes that are all over the office, as you can send messages to a person or a group of people within the office. The tracker will allow your staff to see where the patient is in the office and who's waiting for the service. The Help tab will bring a text document explaining any page within the program to quickly remind you how to use it. With the Support tab, you can instantly be connected to our office and have your support questions answered or watch any of our training videos. The Save, Close, Log Off, and Exit buttons are all of your ending features. Within the Calendar feature of My Vision Express, you can view the calendar in a few different ways. One way is color coding each individual service, as we've done here. With Dr. Franklin, he prefers certain services at certain times. For instance, 9 to 9:15 is an exam, 9:15 to 9:30 is a brief exam, and 9:30 to 9:45 is a contact lens exam. You can also have a calendar come through as blank, which means any service can be scheduled at any time. You can view the calendar by week, day, or a preview screen, which will allow you to call and confirm very easily. We'll go ahead and make an appointment for Mr. Darwin, who's on our phone. If you were making a new appointment, the only information that you would need to gather is first and last name. For this case, we'll make an existing appointment for Mr. Darwin. I type in his information in the search box. It pulls his existing record for me. I double click, and it brings it into his appointment time slot. I'll choose his exam, and I'll change the duration. I want to spend a little bit more time with him. And then I hit OK, and his appointment goes directly into the calendar. My Vision Express also has a direct integration with e-appointments in the tab Calendar. The appointment book integrations are bi-directional, meaning any appointments or changes made in My Vision Express will reflect in tab and vice versa, allowing your staff to use either calendar feature seamlessly, as you see here for Mr. Darwin. When it's time to confirm his appointment, I'll double-click his appointment time and check that I've confirmed it. It'll time and date stamp that I've confirmed the appointment. Then I can send him a welcome packet by fax, email, or if he's in the office, I can print this and have him fill out all of the new information, including his guarantor information and HIPAA consent on the bottom. Remember, all of the letters can be printed, emailed, or faxed from directly in the system. If your office chooses to be web hosted with My Vision Express, you will also have access to the patient portal. Patients will be able to fill out all of the welcome packet information. Your staff can import the information instead of having to manually input the data. From the patient portal, your patients may also send secure messages, order contacts, and pay existing balances, all online. If I choose to pre-authorize Mr. Darwin's insurance benefits, I can, from inside his calendar appointment, go to the Modify button. It'll take me directly to his patient profile. The first page of the profile shows all his basic information. Notice he does have an existing balance with us on the bottom in red. Second tab shows his employer, guarantor, referral, and financial information if I choose to keep that on file. For his insurance information, notice he does have previous insurance info. Now, I do know that he has new insurance, so I'm going to add his new insurance, which is IMED. Bring in his social from the first page of his demographics, and choose the plan. I also will have to authorize those benefits, which I can do directly from within the system by using our partner, Who Is Your Insurance. When I click the Who Is Your Insurance button inside My Vision Express, a search will be done for Mr. Darwin on all of the insurance websites of the plans that I am credentialed to search. Then I can view benefits and authorize without ever having to leave My Vision Express. The insurance and authorization information is saved here to be used later on the quick order screen. The next tab on the patient profile is the Vision RX. This is where all of the current and previous prescriptions are held. Notice that any previous prescription has a line through it so that you don't fill by accident. The Files tab is where we keep all of the paper documents. You can scan and attach anything paper. Next is where all of the history is kept. Order history, appointment history, exam history, and insurance claim history. The Family tab will allow you to link family members together or very easily disassociate them if they do not want to be linked any longer. The Health tab is where you put all of the welcome packet information, allergies, medications, family history, all of those problems. To add something, you just easily choose Add, and then from drop-downs, choose whatever information you're adding in. This same tab is available inside the exam portion for the doctor in case you get inside the exam and they would like to add more information to their history. Custom fields are any 50 questions that you would like to ask the software that we have not already asked. And interactions are completely private notes for you and your staff. This information will never print on any document or email or fax that goes to the patient. Now that we have pre-authorized Mr. Darwin's iMed benefits, we can check him in and get him ready to see our doctor. From a separate computer, laptop, or tablet, the doctor will begin by double-clicking the exam tab along the top. The doctor will then choose the exam that they're walking into, and you'll see it pulls up Mr. Darwin's exam with all of his information. For this walkthrough, we will fast forward to the end of Mr. Darwin's exam, to the assessment and coding portion of the exam. If you would like to learn more about the exam portion of My Vision Express, please contact us at 877-882-7456. Within the exam portion, there is an auto-coder to help the doctor code the exam accurately. When I accept the code that the system has suggested, it brings in the coding with charges. I can also give the patient a referral letter or an exam summary directly from within the system already pre-populated. An exam glance letter will show the patient everything that we have done today as part of our exam with the doctor's signature on the bottom. And remember, you can print, email, or fax any of that. As Mr. Darwin is finished with his exam, he will walk out of the exam room and be intercepted by the optician or salesperson. That person will begin inside the quick order. The quick order is the one-page point of sale section of the software. You'll notice if I change the order type from spectacle lens to soft contact lens, the entire screen will change and adapt to just include whatever I need for that type of sale. Again, if I change it to other, which would be exam only, it changes the screen and only gives me the exam information. For this demonstration, I'd like to show you how to sell a pair of spectacle lenses. I will search for Mr. Darwin's information and pull it directly into the order form. If I'm duplicating his previous order, I can just click the history and choose the order, then take a payment on the bottom. In this case, we'll sell a new pair of glasses. I'll hit the prescription button and choose the most recent prescription from today's exam. Pull it into the order. Notice it comes with his PDs and diagnosis codes. Also notice I have the reading button and transpose button. Reading will change any multifocal prescription to reading only, and transpose will change any plus to minus sil or minus to plus sil. So there's no more quick math for your employees. If you have an on-site lab, you can choose to barcode the lenses in your lab. If not, you will choose to hit the radio button, which will show your entire lens inventory or what you're allowing your staff to sell inside your store. Now, in this particular case, I know Mr. Darwin is single vision, so I can filter by single. I also know I would like to sell him high index, so I can filter by high index. It will show me the available single vision high index lenses. I choose transition, and it pulls all of the information directly into my order form. Next is the frame section. Again, you can also barcode the frames, or you can choose them from that same radio button. By hitting the radio button, it'll give you an entire list of your frame inventory. Now, Mr. Darwin happens to like Calvin Klein, so I can filter by Calvin Klein and see what I have in my inventory and what I can sell to him. Please notice the on-hand counts. Some of them are 0. This means that I don't actually have the item in my inventory. The inventory is a live active inventory. As I sell an item, it will come out, and as I add a new item in, it will go directly in. If I try to sell something that doesn't exist, the system stops me and says that I don't actually have it. Is it something in my inventory, meaning I just miscounted? Is it something that's a patient frame, meaning I need the measurements but I won't be charging them? Or is it something I need to special order from my vendor? If I say I need to order that, and I choose today as the order date, and my supplier, whoever your supplier happens to be, that frame is automatically on a purchase order for whenever I place that order with that supplier. I don't have to worry about losing the Post-it note, wondering about if Mr. Darwin's frame was ever ordered. I'll come to the left and add some anti-reflective. All of your coatings and add-ons will be on this list. Maybe I'll add some nose pads. I also need to bring in his exam charges, so I'll click the exam button on the bottom right. There's the exam that we just finalized with our doctor. I hit OK, and it pulls the exam charges directly inside to the quick order. I have a complete pair of glasses and an exam. Now remember, Darwin has iMed. I can pull in his iMed information, his plan, and Mr. Darwin's authorization number. The system will auto-calculate that benefit for me and tell me what Mr. Darwin is responsible for and what the insurance company will be paying me, leaving the guesswork out of the insurance calculations. On the bottom, I'll take a payment. We do integrate directly with a credit card processing system called XCharge. I'll set a promise date, a tray number, and choose the lab that my order is going to. I can submit to that lab by fax or directly right from within the system. I'll print Mr. Darwin a receipt. Notice you have an area for your company information, your logo, Mr. Darwin's information, and everything that he purchased with us today, including that he has savings and an existing balance, and a personalizable thank you note on the bottom. Everything can be printed, emailed, or faxed to save yourself some paper and ink. I may also need a lab copy, so I can come back in, check lab copy, and print a copy for my lab to have. Notice my company information, Mr. Darwin's information, a barcode for my lab to easily pull up this order, everything Mr. Darwin has purchased with us, his information, his frame, his lenses, and on the bottom, who delivered and inspected the item. If Mr. Darwin would like to purchase an additional item, I can simply click New Same Patient on the bottom of the quick order screen. This will clear out the screen but keep my patient's information. When I change the order type, the quick order screen will adjust to only include the specific information that I need. I can pull the most recent contact lens prescription from today's eye exam, which comes in with the lens information and UPC barcode that was prescribed. If I change the quantity of boxes, the system asks me where I am sourcing the boxes from. When I choose order, the boxes are placed on a purchase order or can be ordered through OptiPort without ever having to leave My Vision Express. I can add a year supply discount and My Vision Express will calculate the preset marketing discount for me. I can then take a payment, set a promise date, and a tray number if necessary, and assign a supplier. I can choose to print a receipt for one order or multiple orders at one time. You may submit insurance claims on the quick order at the time of the sale or by going to the aged receivable report. When you open the order, you may view the details of the order and payments. As you click Insurance, My Vision Express will autofill the 1500 or HCFA form for you. You may then submit electronically directly from inside My Vision Express. If I would like to send the insurance claim as a batch file, meaning more than one at a time, I come to Batch Claims, and I do a search for whichever insurance company's claims I'm looking for. In this case, we would have a day's worth of claims on one screen, and I hit OK to submit electronically directly from within the system, all at one time. Once the claim has been submitted, I should be expecting a payment back from the insurance company. You can receive payments by paper checks or electronic remittance. If I receive a paper check, I come to the payment screen, choose the insurance company who has sent me a check, and search for all of the orders that are waiting on that insurance company's payment. I then tell the system that I've received a check for $100, the check number, and the insurance company's name. Because this is a paper check, I will have to allocate that check according to the information the insurance company has given. If there is a difference in what I expected from the insurance company and what they actually paid, I will have to do something with that difference, like transfer it to a patient, to an existing insurance, or write off the difference. I'll transfer this balance to a patient and write off the other amount for the other order. Once I hit apply, the payments are applied successfully, and everything that has been written off or paid comes off of this list. The only thing left is something with an open balance. Next, I'd like to discuss the dynamic reporting portion inside My Vision Express and how it will help keep the details of your business at your fingertips. You have many reports, including aged receivables, day sheets, employee sales summaries and commission reports, frames sold by collection and manufacturer, orders and charge payment summary, orders by lab and supplier, orders by item type, so which are you selling the most of, orders by marketing to determine which marketing campaign is working best for your Pearl location, orders by physician, orders by demographics, so who are you seeing the most of? And more importantly, who are you not seeing the most of? Who do you need to reach out to? Profit reports, remake reports, so who and why are you having so many remakes? Inventory reports, the metrics based on what is selling and what is not selling in your location. Insurance detail reports, calendar reports and demographics, so when are you seeing patients and who are those patients. Exam reports, unbilled charges and unperformed testing so that you're not forgetting to bill for services. And other information based on everything you do day to day, including your X-charge reports for those credit card processing. We'll take a quick look at an aged receivable report. This will show 30, 60, 90 days what has been paid and not been paid to the office. This is especially helpful if you have outstanding claims that are not being paid for some reason, to be sure that you don't miss out on the window of opportunity for that payment. Don't forget, all of your reports can be emailed, printed, or faxed directly from the system. We'll also take a look at a day sheet. You'll run a day sheet at the end of every business day to close out the numbers for the day. Notice it shows frame, lenses, everything separate, along with services. You have your taxable sales, all of your write-offs, any refunds, cash reconciliation towards the bottom. Also, on the right-hand side of this report, it'll show the deposit for the day, my cash deposit, my insurance check for a total deposit, and on the bottom, my old accounts receivable balance and my new accounts receivable balance. Again, if I'm not closing the store but I need this for my own record, my staff can print, email, or fax it to me. Next, we'll go into the letters portion of My Vision Express, which is the recalling and marketing section of the system. Within this section of the system, all of the letters that you will see here are included with your software. You can also add your own or import others that other My Vision Express users are using as well. Notice you have contact lens refill reminders, exam recalls, glasses recalls, HIPAA consent forms, referral letters, patient birthday letters, welcome packets, and thank you notes as well. First, we'll view an eyeglass recall letter. I click the letter that I would like, and then I can also view the template. The template is already made for you, although you can edit it, and you can also type individual notes if you would like to change your wording. Once I go to my search screen, I'll search whatever recall information I'm looking for. In this case, I'll do a recall from 2012 to a current date and search. Everybody who had an order placed during that time frame pulls up, and this letter can be emailed directly to those people, personalized to them. If I would still like to make labels, that's fine as well. There are my mailing labels. I can also print the mailing labels and print the letter to send out if you choose to. Other recall letters are things such as the exam recall. For many of the letters, including the exam recall, you can search by more detailed information. So if I do a search for an exam recall, there's the letter detail, and I'll do a search for a specific date range. The patients that match my specific search will populate on the bottom of the screen. Then I can choose to recall them based on this information or do an extended search, which will give me even more criteria to recall or market to them, including all of their medication list, their allergies, and their order history. If they ordered with a specific sphere and cylinder combination, specific contact lens brand, or a frame collection that they really enjoy. Once I have narrowed down my specific search criteria, I can then go back and email or print this letter and send it directly personalized to the patient. Another great marketing tool within the letters module of My Vision Express is the Happy Birthday letter, including a 20% off coupon for their next purchase. The Happy Birthday letter can be emailed directly from within the system or printed as well, personalized specifically to the people that match the criteria for the month of the birthday. After the end of the month, I'll go into my reporting and pull an orders by marketing report. This will show me specifically how many patients came with that 20% off birthday coupon and how much money my 3 or 4 minutes of marketing actually brought. As a company, My Vision Express is continuously improving our practice management and electronic medical records software. Currently, we are in the process of beta testing version 11, which will be released later this year. Although version 11 is not yet released, I would like to show you a few key features that have been added to help streamline your workflow. Those modules include the delivery button, the checkout screen, and the after sales module. The checkout screen is a new feature that will allow you to check out multiple orders or multiple patients all at one time. It will also allow you to share discounts, such as a buy one, get one free, between 2 separate patients. I'll search for the patient, bring them all on one order, add a payment, and the system will auto-allocate that payment for me, paying the oldest order first, or the system will allow me to allocate the payment as I wish. Once Mr. Darwin has paid for his item, we can then go to the delivery screen and deliver that item to him or dispense it. We'll search for the item that we're dispensing. If we try to dispense an item that has not completely been paid, the system will stop me and tell me that I need to take a payment before I dispense that item, and will direct me back to the checkout screen to take the payment before I dispense. Next is the after sales module. This is used for all things done after the initial sale, including returns or exchanges. The after sales module comes with a wizard that will ask detailed questions based on exactly what you're trying to do at that time. The after sales wizard will help with inventory control and will also allow you to track remakes and return reasons easily. I hope that you have enjoyed a look into how MyVision Express can streamline and accelerate your business. If you have questions or would like more information, please stay on the call for a short Q&A session.